Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Balata from Roots Community Health Center, reporting for the week of August 29th, 2023. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Starting off with wastewater. This is looking across the country, showing the percentage of wastewater sites across the U.S. that have increases, that's in orange, and large increases, that's in red. These data are through August 20th, with the caveat that the 2 weeks before that, which are in the shaded area, are incomplete. But we can still see that after a dip in June, we have just been going up since then. And this gives us an idea of the nation as a whole, but it doesn't account for local differences. One piece of good news here, though, is that there are more and more sites reporting in. We're up to about 1,350 sites reporting in to make up this graph. And we definitely hope to see that number continue to increase. But from now, we can see that coverage is patchy at best across the United States. This map is looking at the percentage change of SARS-CoV-2 in the wastewater for the preceding 15 days, where the red and orange indicate increases of 100% to 1,000% increase, or even more than that. And we can see that the sites that are reporting really are scattered around the country. So if you don't see your area covered on this map, there are a few other sources linked in the post. I think the key is to find one near you and compare it to itself over time rather than trying to compare across sites, because each wastewater site is unique in terms of a number of different factors, including, for example, how many residents the site may represent. So the trends are really what is important here. So finding a sewer shed near you, if this is something you're interested in, and keeping an eye on that is kind of the way to go. Now taking a look at percent positivity across the nation, still going up. It is at 13.4% as of August 19th, and it was 12.2% the week before. So once again, we had hit a nice dip in early June or so when we were just above 4%. And so we're more than triple that at this point. The number of tests seems to be creeping up a little bit with the last couple of weeks, even though they're incomplete. We're still looking at over 45,000 tests per week, where we were at around 40,000 or less for most of July. So it's still not a lot of tests. We're not doing enough tests across the country at this point to have a big enough sample that's representative, that's going to let us know what's going on with cases anymore. But we know that the percent testing positive is increasing, which, when we take that together with the wastewater data that I just reviewed, gives us a clear indication that there is a fair amount of COVID in our environment that is still making people sick. Now, how sick, that's also a little bit difficult to pinpoint, but taking a look at emergency department visits, and this is the percentage of all emergency department visits with diagnosed COVID-19 in the US, and we can see that the upslope continues. This metric is still the most updated out of all of them. This graph reflects a 7-day moving average as of August 25th. So it's just a few days old. It's possible that we're seeing a slight leveling off, maybe, if you squint and look at it really closely. I'm hoping that's what we're starting to see, but it's not clear. And so we'll have to continue to keep a close eye on that. And taking a look at hospital admissions, once again, this is another area where we were coming down really nicely. We were getting down into the range of 6,000 hospitalizations per week, which is still significant, but that was for much of June. But unfortunately, that trajectory did reverse in early July, and we are now over 15,000 hospitalizations for the week ending August 19th. and that's up from 12,000 the week before. So this is people who are sick enough to be in the hospital with symptoms indicating the need for a COVID test. So hospitalizations with or for COVID are currently 2.5 times what they were for much of June. So we're definitely headed significantly in the wrong direction here. Taking a look in the state of California, we can see that both the number of hospitalized patients, which is on the left, is increasing. It's about an 11% increase from the prior week. And number of new hospital admissions, that's on the right, is also increasing, about a 16% increase from the week before. So what we're seeing nationally, we are also seeing here in California. And taking a look locally in Alameda County, also we can see an increase in new hospital admissions. And even though the numbers are still relatively decent, this represents about a 30% increase in new admissions from the prior week. So this is something we're definitely going to continue to keep an eye on. And taking a look at deaths, deaths had been on a downward trend. They were actually decreasing every single week since late February of this year, when we were at about 2,000 deaths per week, and it was just trending down. But unfortunately, the week ending August 5th, that trend reversed, and we are now unfortunately showing an increase for the third week in a row. And here we see a 21.4% increase for the week ending August 19th. And remember that death is one of the most reliable metrics that we have. If COVID shows up on the death certificate, it means that COVID was either the underlying cause of death, which has been the case 87% of the time, or a contributing cause of death, which is the other 13% of the time. So when we see deaths going up like this after first wastewater, then ED visits, then hospitalizations, then deaths are going up, we know it's real, and unfortunately indicates that cases are still linked to bad outcomes for a subset of people. So to kind of recap on the current status, we have increases in wastewater, indicating SARS-CoV-2 is circulating in our environment, increased test positivity rates, indicating that people are getting COVID, which we know is making some folks sick and having to miss school and work. And some percentage of those people will end up with long COVID or post-COVID events. But it's not just virus circulating. It's not just positive tests. We are seeing this now translating into increased emergency department visits with COVID, hospitalizations for or with COVID. And as a reminder, with no more routine screening happening, these tests really are only happening pretty much in the event that there is some kind of symptom leading to getting the test done. So with all these indicators taken together, we are certainly having an uptick right now. And this is something that is, of course, concerning because it's happening in the setting of reducing protection from prior vaccines or prior infection. And we're anticipating a booster coming maybe in late September. So in this next month or so is kind of a critical time where we want to be avoiding infection. And so seeing this increase happening right now is definitely doesn't feel like the greatest timing. So just a good time to remember to stay vigilant. And in terms of variants, nothing new to report here. This is the same as last week. They only update every other week now. But as a reminder, EG5, which is in the XBB family, was last forecasted at about 21% of total specimens. We're still really pretty much dealing with almost all XBB subvariants of Omicron, but we have been keeping an eye on a newer variant, the BA.2.86, which is not in the XBB family. It's actually a descendant of BA.2, and it does have some features that are causing us to take note. I went over this in some detail last week. If you are interested, you can check out last week's briefing. But the CDC did come up with this risk assessment summary for BA.2.86, and they came out with this last week on August 23rd. There's not a lot more beyond what I reported, which was coming from the UK Health Security Agency last week. The most notable additional information that the CDC put out is that, they reiterated that it's too soon to understand the real world impact of this variant. but that looking at the mutation profile suggests that our treatments should still be effective. So Paxlovid, remdesivir, molnupiravir should all still be effective against this variant. That they believe that the updated vaccine will be effective at reducing severe outcomes, and that there's still no evidence that this variant is causing more severe illness, and that they also believe that the impact on testing is low, meaning they don't expect this variant to be getting around our testing platforms, but they did mention several times that we're still waiting for more information. So this is all still preliminary. So we'll be keeping an eye on that. We'll certainly be hoping that it just fizzles out. But we just don't know which way it's going to go yet. And because it has now been identified in multiple countries around the world, we're pretty clear that there is international transmission that's probably been going undetected for a while. And so we are just kind of keeping an eye on things to see if it is going to result in any major events. So now I want to talk about what I think was a really interesting study published in Nature on August 19th, titled Evidence of Leaky Protection Following COVID-19 Vaccination and SARS-CoV-2 Infection in an Incarcerated Population. And this was a study done within the Connecticut Correctional Facilities. There's 13 institutions, and they looked at a study period which crossed over and included both Delta and Omicron times. They did almost 88,000 SARS-CoV-2 tests during the study period. About 21,000 were PCRs, about 67,000 were rapid antigens. They identified a total of 5,079 SARS-CoV-2 infections. About a third of those were during Delta, and about 2/3 of those were during Omicron. And what they were trying to figure out was, what is the risk of SARS-CoV-2 infection after you've developed immunity from a vaccine or prior infection or both, depending on the type of exposure that you've had. So they were comparing this risk when the exposure to the virus is very high, moderate, or low. They called high risk exposure when a person's cellmate was positive. So you're really in close quarters with that person 24/7 or most of the time. They called it moderate exposure when someone on the same cell block was positive, and then low was when there was not an identified exposure. So this is kind of a unique opportunity to look in a correctional facility, which is obviously a very controlled situation where they're doing a lot of testing, they're doing a lot of contact tracing, and they're able to categorize the type of exposure a person had based on high, medium, or low risk, and then determine what protection from prior vaccine or infection or both would look like. And what they found is that prior infection, vaccine, or both did provide significant protection against another infection when the exposure was low, meaning there was no documented exposure in the cell block co-residents, or when it was moderate, meaning that there was someone positive within their cell block. But when the viral exposure was high, meaning their cellmate had it, none of the groups, not vaccinated, not infected, or both, had a higher level of immunity to protect themselves against infection with either Delta or Omicron. So what does this mean? And it kind of feels like common sense, but actually the way that the study was done and how large it is really did finally give some actual evidence to what I think we were thinking, but it gives us important evidence and proof that I think will really shape some of the things that we are doing in the future. So what it means is, first, basically, it seems that how much protection you get from prior infection or vaccination or both depends on how much virus you're later exposed to. So we still don't know if a higher viral dose can make you sicker or if it's really an all or nothing thing. There's a lot of thought that it may be all or nothing. Either you have enough to get yourself exposed and sick or not, but we don't know that yet. But what this study is doing is illustrating, and I think nicely illustrating, that the prior immunity we have from vaccine or infection is not an all or nothing thing. In fact, there seems to be a gradient of protection where we may be protected from low or moderate exposure, but then the high exposure, which may have to do with the amount of exposure, or it may also have to do with the duration of exposure, or both. They weren't really able to completely sort that part of it out. But nonetheless, there seems to be a gradient of protection, which is why they're kind of calling the vaccine or prior immunity leaky protection, because it gives you pretty good protection with low or moderate exposure, but with high exposure, not so much. So this lets us know that it is not just about having prior immunity or not having prior immunity. There is another mechanism, that is the intensity of the exposure, of the infectious exposure, that may explain what we've seen, which is partial levels of immunity after infection and vaccination. So it's not just the things we talk about, like new variants that escape our immunity or our immunity that wears off over time, but now we are seeing that the intensity of exposure makes a specific difference. And this also has important implications for how we do modeling, how we make estimates about how effective vaccines are, and basically just how we look at risk overall. And the authors say that these findings also suggest the benefit of layered interventions in general, and particularly within densely packed social settings. In the presence of leaky vaccines, non-pharmaceutical interventions have been proposed in tandem with vaccine in order to reduce exposure and mitigate infection spread. And so, of course, we know these interventions include improving indoor air, improving ventilation, and also quarantine and isolation, as well as masking. And their findings, they kind of acknowledge that, yes, this is from a correctional facility, but in the presence of a leaky vaccine in such a facility, layered interventions may afford a benefit in other congregate settings and community settings where prolonged close contact with infected people may occur, such as mass gatherings. So, been saying this all along. We need to implement layers of protection, and the vaccine and prior immunity is just one of those layers. It's not the end all be all. So all of these layers taken together are important, and this study finally gave some real concrete evidence to that. They also know something I thought was interesting was that maybe the leaky vaccines or leaky prior immunity could have contributed to Omicron's spread. So up until now, we've pretty much blamed Omicron spread on immune escape because of its mutations. But the authors here are speculating that because Omicron is so contagious, that it actually generated a higher level of exposure. And so, according to the authors, this speculation invokes the question of whether layered interventions would provide increased benefit in general settings, not just in densely packed settings where highly transmissible variants are circulating. Well, I think we know now that all of the variants that are circulating are highly transmissible. And so I think this again nicely shows that we do need to put other layers of protection in place and not just rely on vaccine or prior infection or immunity from both of those things. So in summary, this study was able to kind of leverage the controlled environment of correctional facilities and the fact that they were doing a lot of testing and a lot of contact tracing, and they were able to do that to approximate whether exposure was low, moderate, or high. And they were able to do enough sophisticated matching and analysis to do a very nice job of giving us evidence that COVID-19 vaccine and prior infection give us leaky protection, meaning that the protection is dependent on how much exposure you get. So now we know that we should use these leaky parameters when we're trying to model out transmission dynamics and to account for the fact that protection from prior infection and vaccine is indeed reduced when there is close, prolonged exposure. And most importantly, I think these findings suggest that layer protections, like the ones we talk about every week here, are needed to reduce the spread of SARS-CoV-2, especially in congregate living settings, within households, and so on. And of course, these layers include things like masks and improved ventilation and filtration. So I am pleased to see some attention being paid to the importance of improved indoor ventilation and it being called out in this study. There was even a story about it on this Sunday's New York Times front page entitled "Bad Ventilation Remains a Threat to U.S. Students." And it's great to see this sort of attention on it. This is a thorough article pointing out that much of the funding made available to schools to improve ventilation is sitting unspent. It runs through examples of how different neighboring schools can be different, between what they've decided to install or how they've decided to pay attention to indoor ventilation or not, and the difference that can happen when you decide to pay attention and clean the air and don't allow viruses or even chemicals to accumulate in classrooms where children and educators spend a whole lot of their time. It seems to me that we may need federal guidelines and oversight to actually make clean air a reality for all of our children, and I really hope to see more attention being placed on this. So in summary, all indications are unfortunately pointing to increase in COVID affecting us now. Wastewater, percent positivity, emergency department visits, hospitalizations, and now deaths are all heading up. We also have a new variant that we're keeping an eye on. We're not going to panic about it. We're going to stay prepared because it is a good reminder that we do remain in an evolving situation, so we should stay ready. We are expecting boosters in the fall, which will be effective against all the things circulating right now. So we hope that things don't change dramatically before those boosters become available. And until then, with cases rising and prior protections wearing off, we really need to be more vigilant to protect infection, reinfection, and spreading it to others. There is mounting evidence of the cumulative effects of repeat infection, and there does not seem to be any limit to the number of times you can catch COVID. We do know that after COVID, we are seeing increased risk of new onset diabetes or worsening diabetes. We're seeing blood clots, heart attacks, strokes, memory issues, neurological issues, worsening asthma. These things are occurring in some subset of people, maybe on their first infection, but maybe not until their second or third infection. Because catching COVID once and doing fine is not a guarantee about the next time. Sometimes repeat infection can be more severe, even in the acute phase. And also, every infection is a new opportunity, maybe even a compounded opportunity for long COVID and post-COVID impacts. So let's keep up our best practices to prevent the spread of COVID-19 and prevent outbreaks. No one layer is foolproof, so we want to implement layers of protection. Stay up to date on your vaccination, wear a high-quality filtration mask like an N95, KN95, or KF94, especially when you're indoors with others. Monitor and improve indoor ventilation and filtration. Whenever possible, gather outside. Outdoors is almost always safer than indoors. If you're someone who should be treated if you catch COVID, then you should know that in advance and you should have a treatment plan. Here are the outpatient treatments, and treatment can reduce the risk of hospitalization or death by about 80% if you start it on time. Starting treatment on time means testing on time, so know where you can get tested. If you don't feel well, please stay home and rest and don't spread what you've got to others. If you're positive for COVID, please test negative before you go back around others because in general, enough virus to detect is enough to infect. If you don't have a primary care provider, please get one. Know how to reach them before you need them. Remember to eat a balanced diet, incorporate vegetables, and avoid those sugary drinks. Consider a multivitamin supplement. Get some regular physical activity unless you are sick. In that case, please get your rest, get your blood pressure checked, get your baseline labs drawn like sugar, cholesterol, vitamin D, manage your stress levels, and get a good night's sleep. This concludes today's People's Health Briefing. We will be taking next week off due to the short week, so we will see you the following Tuesday at 10 a.m.